Hey, everybody. Welcome to another episode of The Bitter Pill. So, today I wanted to talk about yet another example of a really disappointing stance on public health from someone on the left. And specifically, today I want to talk about a recent video made by uh, the Party of Socialism and Liberation candidate for president, Claudia de la Cruz. And I guess without further ado, let me bring up the video and play it for you. And you can ponder what you think, and then I'll tell you what I think and show you what some other people have said in response to her video. Okay, here we go. So let me get to the top of it here. So she says, let's talk about the COVID pandemic and how it's one of the most terrible examples of the total failure of the capitalist system. We fight for a new system that doesn't sacrifice millions of lives for profit. Uh, I guess that kind of begs the question, well, what do we do in the meantime while we still live under capitalism? And as you'll see, she doesn't really have a good answer for that. So, without further ado, let's take a listen to what she says.
Let's talk about the COVID pandemic. It's one of the most terrible examples of the total failure of the capitalist system. Millions of people died around the world, including more than 1 million people in the United States. The Trump administration and then the Biden administration did close to nothing while huge numbers of people suffered. Their only concern and priority was to open the economy back up, no matter how many workers died in that process. When the pandemic hit, the Party for Socialism and Liberation leapt into action. We helped manufacture and distribute masks and other PPE. We delivered tens of thousands of free meals directly to immunocompromised people's doors so that they wouldn't have to go out. But we knew that the only institution capable of carrying out the kind of society wide effort necessary to tackle a pandemic was the government. So our main focus was putting pressure on the state to demand that saving human lives be prioritized over rescuing corporate profits. In March of 2020, we put out a people's program to fight the virus, where we demanded four emergency measures to be taken. One, full sick pay and 100% unemployment insurance for every worker, no evictions or foreclosures. Two, wartime emergency production and distribution measures to overcome shortages in COVID 19 test kits, ventilators, protective, and medical equipment. Three, healthcare, free healthcare. Four, housing for all. We organized car caravans protests nationwide demanding government cancel the rents and forgive the debts that tenants had accumulated over the course of a crisis to prevent a wave of foreclosures. The government is the only thing in society that has the necessary power to take the steps that would be required to truly eliminate the virus. This is true whether you make the decision to wear a mask or not. Mask or no mask, COVID will never go away unless the authority of the state is used to achieve universal vaccination while keeping essential goods and services available during the necessary periods of lockdown. Capitalism wants us to think only in terms of individual responsibility. It's tempting to think that the only thing we need to do is convince or coerce everyone into wearing a mask, and then COVID would vanish. But that's just not true. Let's not reduce this to a question of individual choices, a question of people who wear masks versus people who don't. Let's fight together against capitalism and win a new system that won't sacrifice millions of lives for profit.
Okay, well, Yeah, basically, this boils down to pipe dreams about what you would do about COVID or other infectious diseases if you had state power. But really, Claudia doesn't even have those because, I mean, all she's saying is that, well, the state should make sure that everyone is vaccinated. Uh, she doesn't say how she would achieve that. Universal vaccine mandates, I guess. But she has no specifics other than that about how the government should act to control infectious diseases. Universal health care, sure, that would be wonderful. That's not a disease control measure. It's a measure for making sure we have the resources to deal with a pandemic. Um, Universal vaccination would be nice, but and certainly the vaccines are valuable, and I want to stress to the YouTube censors that I am not going to say anything here that contradicts the guidance or views of uh, the World Health Organization or local health authorities or any of that. I believe the vaccines are safe and effective, etc. But we have so many examples of countries that had really high vaccination rates. China, for example, around 90% or a little over 90% vaccination rate. And, almost everyone there got in China got COVID once the government lifted uh, all the measures that they had in place to prevent the spread of the virus. It simply spread to almost everybody. So until we have vaccines that provide stronger protection against infection than what the current vaccines do, where with the new variants, from the stats I've seen, roughly they do about as well at protecting against infection as flu vaccines, which basically they reduce your chances of getting the disease and spreading it, but they certainly don't eliminate it. Many people who are fully vaccinated don't get COVID, and many people who are fully vaccinated do get COVID. So, so this is not a prescription for how to control an infectious disease. First of all, that spreads through the air, and what about in the meantime when we still have a worldwide COVID pandemic? Regardless of what Dementia Joe says, Joe Biden says the pandemic's over, but those of us who follow the statistics on, for instance, wastewater levels of the virus know that it's not. We know that just this winter, there's been as high a level of prevalence of the COVID virus in the wastewater as there has been at any other point in the pandemic other than when we had the first Omicron wave a couple of years ago. So, this virus is still with us. Uh, Recently, a study came out showing that approximately a quarter of the US population indicated that they had had lingering COVID related symptoms for more than 3 months. In other words, they had symptoms of long COVID. Um, and, you know, pressure the state to implement universal vaccination is an appropriate ask, but that's not going to accomplish a whole lot given the present configuration of political forces. And she doesn't propose anything else concrete. She doesn't even mention any specific infection control measures other than vaccines, which she fails to acknowledge are not preventing enough COVID infections to keep COVID in check, and still wouldn't, even if we had a much higher vaccination and booster rate than we do, unless there are significant improvements in the vaccine's infection prevention ability. And she also mentions masks, but she demeans their value for controlling infections. So let's look back at what happened during the early stages of the pandemic. We had mask mandates in many places, in most states in the US and most countries around the world. We had sets of measures collectively called lockdowns to control the spread of COVID, contact tracing in some countries, and so forth. And it didn't wipe out COVID, but it certainly, in countries that took the strictest measures, such as China, it really limited the spread of it. And a side effect of that was that there were hardly any cases of colds and flu during those first couple of years of the pandemic when there were strict measures taken to control infections. One strain of flu was wiped out completely, it went extinct. And otherwise, there were barely any flu outbreaks at all during those first couple of years of the pandemic in countries that took strict measures to control COVID, such as China, which additionally, by the way, were all collectivist cultures where people look out for each other by doing things like everybody wearing a mask. But she says, oh, it's just an individual choice. It's an individualistic measure. We need collective action. We need the government to take action. We need to lobby the government. Well, you know what? You yourself talked about the measures that PSL took, as a group to try and help their community out. Um, early in the pandemic, making and distributing masks, providing free meals for people who were due to immune impairment, unable to leave their house and so forth. Pushing for sick leave and so forth, paid sick leave, so that people wouldn't have to go to work sick. And where's all that now? This idea that wearing a mask is nothing but an individual choice that has no significance as a measure taken on behalf of the collective is, ridiculous in a number of ways. First of all, masking is quite an effective infection control measure. There's a ton of studies that show that now. And additionally, masks are a device that generally they do a better job of protecting people around the mask wearer if the person wearing the mask is infected with something than it does protecting the wearer, him or herself. Now, a good mask certainly will provide a significant amount of protection for you, the wearer, and that the protection that you have is stronger the more other people are also wearing masks, and you're protecting others if you are infected. So it's motivated. Excuse me, still getting over this cold. Wearing a mask is motivated by concern for others. It's an example of a collective action. And there are other effective measures for controlling infections that Claudia fails to mention and that individuals can take, such as getting HEPA filters to filter the air, improving ventilation, maybe getting a UV light that kills viruses. All of these are things that we as a society, or at least those of us who care about controlling infectious disease, can encourage. with or without the current corrupt capitalist government's help. They're not just individual choices, they're what people who care about others can act collectively to implement on as wide a scale as possible. Now, that isn't a revolution. It doesn't involve creating a socialist government. But how can you hope to build a revolutionary movement if you're not successfully pushing for changes along the way? If you're not showing people that there's concern for the community there and effort to implement measures in the community that will help control infections. Uh, so let me just look at what some other people said in reaction to uh, Claudia's video. Um, well, first of all, here's a summary of all the things you can do to reduce COVID-19 transmission, uh, none of which she mentions. You can wear a mask, a well-fitted N95 or better mask. Oh, shoot, I'm not sharing this. Sorry. A well-fitted N95 or better mask helps protect both the wearer and people around them. And the more people mask, the better. Ventilate. Open as many windows as possible. Fans in windows and doorways increase ventilation. Filter. Use portable HEPA filters to reduce indoor airborne viral particles in the air. The more, the better. Hold events outside when possible instead of indoors. So, if you want to have an event in a restaurant, let's say, or if you just want to dine in a restaurant, you get seating outside. Test for COVID. You stay home if you're positive. Monitor the air quality to see how your ventilation is. The worse your ventilation, the more likely COVID is to spread. These are all things that we as individuals can do and that we as a community can promote, irrespective of what the government does. And obviously, it's important to pressure the government to take the control of airborne infectious diseases seriously and implement measures beyond just vaccines to try and do so. But we don't have to wait for the government to act. We can act ourselves. So Meg's response to this is, I was on board with this messaging until she suggested we have no responsibility to mask. Of course, the government can change things the most, but collective protective action matters in the meantime to keep vulnerable people safe. This is so fucking disappointing. Jesus fucking Christ. Win a new system that doesn't sacrifice millions, they say, as they ignore or sacrifice immunocompromised and disabled persons to place the onus of blame on capitalism and not a failure of community care for one another. And I mean, that's what comes to mind as the central philosophical problem with the way of thinking that Claudia de la Cruz and many others on the left are displaying. If they even take COVID seriously at all, which many don't, they only talk about public health measures on the level of the government, and anything that we or I mean, really anything. Take climate change. Yeah, sure. Let's get the government to take action that will promote a transition to renewable energy and so on and so forth to a much greater extent than they do now. But this idea that we can't do anything meaningful as individuals is ridiculous. As I've talked about on how here before, simply by changing our diet, uh, you know, not consuming massive quantities of meat like we tend to do in the West, which um, puts enormous pressure on our land resources. Countless acres of forest are cut down to create grazing land for cattle or to um, grow crops to feed the animals that we eat. Um, Cattle and other ruminants themselves emit huge amounts of methane, which is a very, very potent greenhouse gas, um, simply by changing our diet or you get, using mass transit if we have that opportunity, or getting a car that's electric or hybrid or something. Uh, there are measures we can take as individuals. Um, we don't need to wait on the government. And the same is true with trying to control infectious diseases. Um, so really, I mean, she sounds almost like a libertarian here. I mean, okay, granted, she's promoting measures on the government level to control um, COVID and other infectious diseases. So that's not libertarian. But this idea that we should just do whatever we feel comfortable with, wear a mask or don't wear a mask, and it has no consequences for anybody else what we do. I mean, that's the quintessence of individualistic thinking. That's not how a person who uh, promotes collective action um, or promotes a government that's acts on behalf of the working class. That's not a perspective that they should take. Is you know whatever. We just need to get the government to do stuff for us, and we don't need to do anything ourselves. That just is a highly irresponsible and really, frankly, ableist perspective. As many people commented on her video when they've been to her campaign events or to protests, for instance, that she's attended, she never wears a mask. She refuses masks if any are offered to her. So, uh, the days back in 2020 when she and her organization were promoting masking and giving out masks, those are long gone. And now she's adopted this mentality is so prevalent in our society today, thanks to the brainwashing of the corporate media and so forth, that, oh, this is over. We don't need to worry about it anymore. But, we should do something in the future to make sure our government provides better health care. So, uh, what can I say? This is just highly disappointing messaging from, Claudia de la Cruz. All right. Well, that's all I wanted to say about this for now. Um, I'll have more to say about the pickle we're in with the COVID pandemic and people's refusal to acknowledge that it still exists and we still need to do something about it in the future. But anyway, um, personally, I wasn't going to support Claudia anyway, but if I were considering her this failure in terms of um, thinking about public health would certainly cement the deal to not support her. All right. Hope you've enjoyed and learned something from this video, and I will see you next time.